Hi there, this is Dr. Devin Barley with Greenwich Bay Chiropractic, and we've been talking so much about arthritis because we know how many people it affects on a daily basis. And what we're going to talk about a little bit today is the decompression therapy that we offer in the office. So I always like to talk about anatomy whenever we talk about a specific condition to help broaden our understanding of exactly what process is happening. And while there are many different causes of arthritis, a main cause is osteoarthritis, or arthritis that happens from mechanical stress over time or physical stress over time. And what we know is that when we're looking at the spine, if we look at a normal joint, you have the bone above, the disc in the middle, and the bone below, and then that nerve exits out in between. And with a really healthy disc, nice lubrication in those spinal joints, what we know is that it's really hard for the joints to kind of start to get arthritic and kind of stiffen up because that mobility and that structure is good. What we know is that over time, as the spine starts to change, right, that window gets smaller, that disc is a lot thinner, you see all these bone spurs around the joint. Basically your margin for error is just lower. So what I tell people is, what you're doing every day is going to cause your pot to essentially spill over depending on what you're doing. It's the same thing as someone with, a compressed spine with a lot of arthritis in it. They may put the creamer on a lower shelf in the fridge than they normally do, bend over and throw their back out where they go, ow, right? The person with all the wiggle room in the world for that nerve and good spinal function is going to bend over and not even notice it, right? And so what we want to do with spinal decompression is reduce the amount of mental real estate that these conditions are taking up for you. And one way that we do that is through spinal decompression. And what that does is essentially, it's going to help pull those bones apart, okay? Pull those bones apart to create a vacuum in that disc space or pump that disc. Basically, like when you open up an accordion and it draws in air, the goal of decompression is to try to create some more mobility and space between the joints to help your body move them, lubricate them, and over time decrease arthritis type symptoms, especially if arthritis or spinal stenosis is the cause of some nerve impingement or entrapment that you're feeling. So spinal decompression is run by a computer. It's a computer run protocol, and it has different settings and different weights based on the condition that you're dealing with currently. But what it's going to do again is really open those spaces up, allow that signal from the nerve to kind of get through, and over time allow your body to heal. It's a game changer for a lot of people in the office, especially those with arthritis and mobility issues. So if you're experiencing any kind of mobility issue and you think it's due to arthritis, it's an absolutely great option for you. So that is one of the many things that we offer in the office, but it is an absolute game changer in terms of mobility and arthritis. Thank you so much for listening. We'll see you on the next video.